Hello, this is the second video I'm recording, and in this video, I want to talk to my diagnosis. So it was about, I believe, end of July 2024 that I was diagnosed with metastatic colon cancer. As I said in the previous video, I'm an oncologist, and now I'm a cancer patient. I had cough for about 3 months last year, and I thought this is allergy. I went and used some allergy medication, didn't work, and then I ordered X-ray for myself. The X-ray didn't show anything special, and the cough didn't go away. So I decided to go to a pulmonologist, and I asked the pulmonologist to do a CT scan, and CT scan showed, unfortunately, some one-sided, right-sided pleural effusion, means there is a fluid around lung. There's two layers around our lungs, and between them, sometimes there is accumulation of fluid, which is should not be the case in a normal situation. And that small fluid around the lung was not normal. So the lung doctor advised me to have the fluid out and check it for infection or other causes. And in a young person, malignancy or cancer is not the first thing that you think about. Mostly you think about tuberculosis, other infections, a lot of other pathologies, but cancer is not on top of the list. When the result of CT scan was back, I went and reviewed the CT scan with the pulmonologist, and then I asked the pulmonologist to scroll down to check my liver, because when you do the CT of chest, sometimes it covers a little bit of your liver too. Although it's not a CT of abdomen and pelvis, the CT of chest sometimes covers some part of your liver. So if you have a liver disease or some inflammation there, that can be because the liver is just below your diaphragm, and just in that area that you have fluid buildup. It can be reactive. It means that if you have liver disease, then you can have a little bit of fluid on top of your liver, which is around your lung. For that reason, I wanted to check it, and when I checked it, I saw some lesions in my liver, and it was very frightening for me. And then there was no report about liver lesions. So I went back and called radiologist who read the CT scan and asked him to comment about the liver lesions, because that's something, I'm not a radiologist, but I can see them. It's obvious, it's very clear that there are some irregularities there. This is not normal to have round lesions in your liver. And the radiologist told me that your CT scan was without contrast. I cannot comment about that. So I ordered a liver function test for myself. We call it CMP, Comprehensive Metabolic Panel, and it is about your liver function, your kidney function, and your electrolytes. And this is a very routine test. And it came back, and next day showed that my liver functions are to the roof. Basically, they were 10 times higher than normal limit. And that day I was in clinic. I was seeing basically my last patient as an oncologist, and I was examining the patient. Then my wife called me and said that your liver function tests are back, and they're really high. And then I finished the visit. I had another two patients, and then I told the clinic manager I can't see them. And then I asked the nurse practitioner to see them. They were simple follow-ups, nothing complicated. And I reviewed the cases with nurse practitioner. She kindly accepted. I called one of my colleagues, my mentor, another oncologist, and I told him about the story, and I asked him to order CT scan of abdomen and pelvis for me. Stat means right away, and to be done the same day. And I quickly drove to hospital, and I did a CT scan of my abdomen and pelvis, because again my liver function tests were elevated to the roof. It means that's something wrong with my liver. And as soon as I did the CT abdomen and pelvis with contrast, I went to the radiology reading room. I didn't wait for any doctor to call me. I didn't wait for my colleague who ordered the test to call me, because usually that happens the next day or so. And I couldn't just wait. I was just dying to know what is happening, and I had this hunch that uh, this is not good. Basically, when you have fluid around your lung and you have liver lesions and elevated liver enzymes, it means that you have cancer. So, and you're a cancer doctor, so you know what's happening. And I couldn't fool myself. I know something is happening, and this is most likely cancer, unfortunately. I don't know, I wanted to torture myself or what, but basically I couldn't wait anymore. So I found the reading room, knocked the door, entered the room, found the radiologist, told him I'm Dr. Safarpour, and I'm one of the oncologists here, and I have the CT scan done just right now, and can you please review the CT scan with me? And he said, yeah, why not? And radiologists, they usually sit in the dark room and review the images and type the results and or dictate the results. They mostly they don't have interaction with patients. So no offense, but radiologists are not the best people to deliver bad news. You just keep that in mind. So it's not a good idea to go there. And he reviewed the CT scan, and he turned to me and said, yeah, you have multiple liver lesions and you have peritoneal carcinomatosis. And I said, what? Are you sure? And he said, yeah. And I never forget. He said that in a very relaxed way. And for me, it was the worst moment in my life to hear I have peritoneal carcinomatosis, meaning I had cancer spread in my abdominal cavity. And that is very bad, very, very, very bad. So that moment I knew I have cancer. It was confirmed. And I have multiple liver lesions. I asked him, he said maybe more than 6 or 7. And I had basically cancer in my abdomen too. And yeah, called the oncologist, my colleague, my mentor, who is now my oncologist, and asked him to do a CT of chest with contrast. We did that. We did also a PET scan the next day. It's very hard to schedule a PET scan next day, and I'm happy I had this privilege to do all the tests very quickly. The PET scan next day showed confirmed the peritoneal carcinomatosis, multiple liver lesions, some lymph nodes inside my chest, left side of my neck, and pleural effusion around my right side of the lung. And then I discussed. At that time, we didn't know where is the cancer coming from, so we decided to have a biopsy. We did a liver biopsy, and at the same time, we because the PET scan also showed some uptake of my colon, sigmoid colon. That's basically last part of the colon, just before rectum. And I went for colonoscopy, and colonoscopy showed a small polyp, like 2 centimeter in my sigmoid colon, very small polyp, and flat polyp, and that the small polyp caused all this trouble and went to different sides and spread everywhere. And next day I had my port placed, and the very next day I started chemotherapy. So everything happened maybe in 3 or 4 days from the diagnosis to starting chemotherapy, first cycle. So that was in a nutshell, but it was a lot, that was too much to digest. I mean, for a cancer patient, it's very difficult. Usually they have a lot of questions. But when you're an oncologist, you're answering the questions yourself. And the liver biopsy showed most likely coming from lower GI tract, and we confirmed that with the colonoscopy and that polyp. So that means I had stage 4 disease, metastatic disease. That's the worst news you can hear, but at least between GI, gastrointestinal tract malignancies, colon cancer, I would say if I could pick one, I would pick colon cancer. Is better than stomach cancer, better than pancreas, obviously, and biliary tract. They kill faster on average. So, and I said during the last video that the 5-year survival for colon cancer, metastatic colon cancer, is around 20%, maybe 25%, something like that. Means that 1 out of 5 or 4 patients can survive 5 years. So that's not good. And I'm 43 when I was diagnosed, and this is the worst news I could hear. So I came out I just go back a little bit, came out of the reading room. My wife was sitting in the waiting area. It was 4 p.m. And I told her, the first thing I remember I told her was, I'm gone. I'm going to die very fast. And she said, what? I said, yeah. The CT scan was terrible and showed that I most likely have cancer. So that was a flashback. And she started crying, and obviously that was beginning of the very hard journey for us. And yeah, usually you have colon cancer. If it is earliest stage, meaning stage 1 to 3, you may have some pain in your abdomen, you may have some bleeding in your stool, you may have change of caliber of your stool. Means that this is like pencil-like, narrow or thin, whatever you call it, and you know, weight loss and other symptoms. But I didn't have any of this, I didn't have blood in my stool. Maybe I had, because I usually don't check my stool. I don't like to look at my stool, and maybe I missed it, maybe it was there. But I remember I had one time blood in my stool, but I had hemorrhoids from my childhood, and I related to that one, and I didn't have further bleeding episodes, so I didn't do anything about it. So that was about bleeding, and yeah, nothing else. I didn't have pain or something. No new constipation, no nothing. And basically the polyp was flat. That's why I didn't have any symptoms. So in that regard, I was very unlucky because it didn't give me any, red flag sign, any alarm, any notice, anything that I would do a colonoscopy, because colonoscopy would save my life. The age of first colonoscopy, screening colonoscopy for average people is 45. If you have a first degree relative with colon cancer, they do it at the age of 40 or 10 years sooner than the age that your relative had colon cancer. I believe because the incidence of colon cancer is rising in young people in future, the recommendation should be to do it around age 40 or even sooner. There are new blood tests that they're working on. They may do it sooner, but I was 43, just 2 years before my first colonoscopy, screening colonoscopy, that I was diagnosed with this. In that regard, I was very unlucky. And so that was the story of my diagnosis, and what happened to me. And in the next video, I will talk about my feelings and what happened to our family, how we accepted this diagnosis, and etc. Thank you.